If you've read anything related to resistance training, you know that heavier weights at 70 to 85% of your max are the way to go to make gains in mass and strength. But what if you could get strength and hypertrophy benefits with loads at 40%, 30%, and even 20% of your max?
This may seem hard to believe, but it's possible using a technique that's been around for almost 40 years. It's well researched on safety, effectiveness for strength, rehabilitation, and recovery, and it's known as BFR, or blood flow restriction. Blood flow restriction was popularized in the 80s in Japan, and it works by restricting the blood flow out of a region rather than restricting a blood flow into the region. When you first hear about it, it seems like it would be a safety issue because the perception is that you're actually restricting blood flow into a region. But all we're actually doing is taking some pressure, applying it to your thigh or your arm, and you're restricting the venous return. So our heart pumps, takes oxygen-rich blood to a muscle and to tissues in our body, and then once the nutrition, the oxygen, etc. has been used, the veins return that deoxygenated blood back to the heart. All we're doing with BFR is we're restricting the return of the blood flow out of the area. That causes a lot of different metabolic changes. Our muscles are broken down into mainly two fibers, one that is more oxygen dependent and one that is less oxygen dependent. The one that's less oxygen dependent is the muscle groups that we're trying to increase when we lift with heavy weights, our type 2 muscle fibers. When we reduce the oxygen in the area, our muscles are forced to go down the route of the type 2 muscles, even though the load is less than you would normally use to try to focus on type 2 muscle fibers. Stress that leads to change in your muscles is either mechanical or metabolic. When we're lifting the heavier weights, we're breaking down the tissues and causing mechanical stress and metabolic stress. When we're doing blood flow restriction, we're focusing almost exclusively on the metabolic stress. That metabolic stress will lead to increased hypertrophy, increased strength, all while reducing strain on the joints, ligaments, and tendons. This is why it works so well in rehabilitation, because we can do low loads and get the same benefits to the muscle that we would in a gym with higher loads. We can do this early on in the rehab process, which makes it ideal in the early phase of an injury or post-surgically. I've been wanting to do a video on blood flow restriction training. I reached out to the team at RecoverFun and they sent me a set of blood flow restriction cuffs. I like the unit because it is one of the most affordable options that has the sphygmomanometer with quick release valves so that you can control exactly how much pressure you're applying on your legs and arms each time you do the workout. I also have your basic entry-level BFR bands where you just tighten them up and just basically go off of feel. The research emphasizes to be around the 7 out of 10 range when you're self-evaluating the tension and discomfort in your arm. So how do we apply these principles to our training program or to our rehab programs? Well, you're going to apply the restriction cuffs in one of two places, your upper thigh or your upper arms. And when you take these ones out of the box, you just open up and you can adjust it to your arm size. You're going to go in as high as possible in your arm. You just apply with slight pressure, wrap it around, and you're all set. And then you just pump it up to your desired level. What I like about this is it has this 90-degree angle here, so you can just pop this in one-handed. So it works really well when you're using it at home, and pop it right off with a little button. Here, I've been using these for over a month and they've held the air pretty well so far. Now that I have these pumped, I'm ready to do my workout. Here's the principles. You want to be 7 to 15 minutes max. You want to be using a weight that's between 20 and 40% of your 1 RM. So I'm just going to take a 10-pound bicep. Here I have my Bowflex adjustable so I can quickly change to the weights that I need. And then pretty much all of the research on this says to go through 4 sets. You want to be in that 50 to 75 rep range. So you do 30 reps on your first set to try to get as much metabolic stress started. And then you're going to do 3 additional sets, 15 reps each. You want to keep your rest breaks short in between your sets. 30 seconds would be preferred, definitely less than 45. So you just build your repetitions and you're going to be able to get through individual exercises in just a few minutes. I like to combine this with my regular higher weight training. I'll finish out my session by doing the blood flow restriction training. All right, so we're just gonna take a rest. I'm not sure that was quite 30, but you'll just do your 30-second rest, and then you're gonna work through 3 additional sets, again, 30 seconds in between each. Now with your standard cuffs, you could just pull your handle, pull your lever, release them. With these, you can unzip them and take them off, or you can just simply pop your attachment back on and then just take the air out that way. When we wanna do our leg workout, you can see with these, for the leg, it's bigger, obviously, than the arm, so we just unhook the strap there, and around we go. You're not applying this tightly because your cuff's gonna do that work. You got it ready to go, and then you pump it up to your desired level. The leg's gonna be much higher than the arm. For me, it's usually in the 170 range. Then I can go through leg extensions, low weights. I can use squats, still staying in that principle of 20 to 40% of your 1 RM. 4 sets, 30, 15, 15, 15. Bodyweight squats will often be enough for the blood flow restriction because again, you're just doing 20%. You can certainly use a bar and calculate the percentages based on your 1 RM. So who is blood flow restriction good for? Well, essentially anybody who's looking for hypertrophy. Like I said, multiple decades of research show it's extraordinarily effective, it's incredibly safe, and especially in rehab settings, it's going to allow us to improve muscle strength and hypertrophy without putting load on recovering tissues. One of the other things that's really neat about blood flow restriction is that numerous studies have showed a systemic benefit. So while we apply the cuff in the upper arm and we're restricting blood flow back out of the arm, the thought might be that we're only getting the benefit in the arm beyond the cuff, but that's actually not true. For example, researchers applied blood flow restriction cuffs just to the legs and then followed participants and saw a significant increase in bench press strength. As with any technique, we're always concerned with safety. Countless studies have shown us that blood flow restriction training does not increase coagulation activity, it does not impair blood flow long-term, it does not impact nerve conduction velocity, short or long-term, and it does not cause any type of considerable harm outside of normal resistance training. There doesn't seem to be any difference between regular training and blood flow restriction training in terms of safety when you follow the protocol as I described in this video. If these techniques are used appropriately, we can essentially eliminate or at least significantly reduce the muscle loss that happens after a surgery or after an injury in a period of immobilization. If this is new and helpful information to you, do me a favor and click that like button. It helps spread out the message and get the video to more viewers. To watch another video, click down here. To subscribe to my channel, click over here. Remember, if you want to keep improving, you got to keep it moving.